It's all about labiaplasty recovery. Today I have my assistant with me who will be reading emails that we've received from our office specifically about labiaplasty recovery. I hope you find this helpful.
First question is from Christy in West Sac. When can I drive and return to work after labiaplasty?
This is a very common question. It really depends on the type of labiaplasty that you've had performed. If it's a linear labiaplasty, you can generally return back to work within 5 days. We ask you to stay at home for at least 3 to 5 days. If you have a wedge resection labiaplasty, which is a little bit more elegant but also needs a little bit more care and tenderness while taking care of it, and I would ask that you not drive for 3 days and return to work in 7 days.
She also would like to know if there are any other restrictions.
Well, the other restrictions would be the go-to position for labiaplasty recovery is on your couch, feet up, watching Netflix, whether that be literally or figuratively. It may also be a time that you can catch up on reading or do some activities that you haven't had the time to do. This doesn't mean that you're bedridden, homebound, but we do ask you to avoid anything that increases rub, bending, squatting, so that labiaplasty can set in nicely for you.
Anne from Davis has 2 questions. Are there sutures to be removed after labiaplasty?
And great question. Short answer is no sutures need to be removed. They all dissolve. There's 2 layers in closure. The first layer is the deeper layer, the second layer is the skin layer, and that skin layer generally will dissolve within 7 to 10 days.
Should I use pads or can I use tampons with my period?
We generally recommend that you use pads at least for the first menstrual cycle after your labiaplasty. Generally at that time it'll be about 4 weeks. You'll usually have seen your surgeon and they will let you know if tampons are appropriate at that time.
Karen from Sacramento would like to know, what is the best way to keep yourself clean after labiaplasty?
Well, the best way to keep yourself clean is, in our office, we provide you with a peri bottle. That peri bottle should be with you anytime that you use the restroom to keep yourself clean. We ask that you do not rub, we ask that you avoid toilet paper, but yet use maybe Tux pads that we also provide, and we ask you to pat dry, or you could use your blow dryer, high flow, low heat, to keep yourself clean.
Can I take a bath?
Baths, we generally recommend that you do not soak for at least 10 days. Generally, you can have a bath after 7. We just don't want those sutures to dissolve too quickly.
Charlene from Roseville asks, when can I have sex after labiaplasty?
Short answer is 6 weeks after labiaplasty. But this is what I tell patients. That first week when you're with your partner, act like you don't know each other. Second week and on, anything above the waist is okay. By 4 weeks, self-pleasuring is fine, and then by 6 weeks, intercourse is appropriate. Sometimes I also get the question, is there a chronic pain? Is there pain after having a labiaplasty? I will say the first time, it may be a little stiff, but it will generally work its way out and be very comfortable. There have been no patients that I've done that have had any hypo or hypersensitivity after labiaplasty.
Tanya from Sacramento asks, what are the danger signs to watch for after labiaplasty?
Danger signs after labiaplasty include, number 1, signs and symptoms of infection. That could be fever, that could be a malodorous discharge from the vagina, and extreme tenderness. The second thing is each day should be a better day. So if you find that you're getting worse day by day, that's another danger sign. The last sign is bleeding. You will have bleeding in the first couple days after labiaplasty, but you don't want to look down and see a giant goose egg, which would be similar to that of a hematoma, and that would need to be managed by your surgeon.